Again, thank you for joining the video number 13 in this series of staying healthy and preventing COVID-19 infection during this current pandemic. So, I had mentioned twice in the previous videos the importance of nutrition and how the malnutrition actually weaken your immune system. Especially micronutrient malnutrition can significantly weaken the immune system, as happening in the elderly and disabled and sick people generally. So in addition to the ongoing comorbidities, malnutrition, specifically micronutrients such as vitamin D and antioxidants, can really cause problems with the diseases like coronaviruses. Because it will overall weaken the immune system, making people vulnerable to not only the viruses but also to other diseases, both infectious and non-infectious. The world, including U.S.A., Europe and China and other countries, none of them are prepared to handle the pandemic, strangely. Rather than only focus on COVID-19, scientists must therefore start immediately working also on the new and cost-effective technology that will be affordable to all countries to face the next pandemic or epidemic which can come anytime from next year. So technologies such as the use of ultraviolet A and B are not effective in destroying coronaviruses, specifically COVID-19. So we need something better and different on a long-term basis that is affordable for majority of the people in the world. One such example is the use of far ultraviolet C rays, so-called UVC. Is between and from 202 and 222 nanometers that can instantly kill airborne microbes and surface pathogens, including viruses, bacteria, in seconds. So there's no chemical, no electricity. All you need is UVC mediated rays. Unfortunately, natural UVC rays are near totally filtered by the atmosphere. They will not enter into the stratosphere or reaching the Earth's surfaces. So therefore, industry should generate the UVC emitting bulbs and scanners at a larger scale, especially scale-up version for hospitals and larger buildings. But the key is to keep the cost minimum. Smaller scale far UVC rays emitting equipments are already available in the market for the last about 10-15 years. You can buy them from many high-end websites. However, once mass produced with the new technology and scaling up in sizes, this can be installed in any building at a fraction of the cost of taking care of one patient. Research laboratories, health facilities, airports, and in all public places, including the places of worship and shopping malls, supermarkets, schools, universities, and in all congregations to protect people. As I mentioned in my video 2, one cough on average emanates 2,000 plus droplets, and one sneeze emanates more than 30,000 smaller infective droplets. Many of them become airborne, and therefore inhalation is the way virus can enter into the human body. Having far UVC rays installed in these circumstances will immediately eliminate such viral or bacterial spread, including tuberculosis, as well as the COVID-19 like viruses. At this stage, out-of-the-box thinking and means of technology are necessary, and in fact, I would say essential, and to design and implement such at the earliest possible. Even for this particular outbreak, it's not that too late to bring this equipment to the market within next 2 to 3 weeks. So getting ready with the new effective tools to overcome yet another pandemic in 2020 and above is the responsibility of the industries and all countries to keep an eye on that kind of thing happening. So in this regards and controlling the COVID epidemic, I also emphasize the importance of private-public partnership, including for drug development, vaccine development, as well as protecting the community in need. But didn't happen for the first 2.5 months or so during this particular epidemic. However, I'm glad to see that many large pharmaceutical organizations are getting united and putting hands together and resources together to develop new drugs and particularly effective vaccine for the benefits of the world. So it is necessary to strengthen the public-private partnership, especially for developing diagnosis kit as well as virus, so the vaccines as well, including the provision of N95 face masks at a very affordable cost throughout the world. There's no proven effective drug or treating or vaccine is available to COVID-19 yet. Nevertheless, there are many currently working on developing such drugs and vaccines, and we sincerely hope they'll be available at the earliest possible. Meanwhile, there are already available economic antiviral agents such as anti-malarial treatments like chloroquine is available that can be used, in fact I would say should be used at least for the patient in ICU or somebody with a serious illness to protect their lives, because this can shorten the duration of illness and prevent developing severe pneumonia and respiratory distress syndrome. So meanwhile, the people, you and I, the society had the moral responsibility to protect each other and prevent exposure of others. And the government has the responsibility to protect all citizens and provide the factual information on a daily basis and protecting people both from the virus and starvation and other harmful things. So what are the best practices we should adhere to? In fact, one must use face masks when you're going out, in addition to hand washing and personal hygiene, that we discussed in previous talks, and abiding with the mentioned public health guideline and any locally enforced guideline and the rules are essential to overcome the current epidemic. So in this series, about suggestions and keeping your loved ones safely are not considered as medical advice, but are public health guidance to anyone to use their wish to protect themselves, their families, and indeed the community at large. Thank you again, and this is Professor Wimalawansa, Professor of Medicine and Nutrition in New Jersey, United States of America. Stay healthy.